My name is Wilson Aruasa, Chief Executive Officer of this institution, the National/International Teaching and Referral Hospital covering the western half of Kenya with a total of 25 counties in the what used to be called Rift Valley Province, Nyanza, Western and Central Kenya. We see patients from the rest of the country all the way to Mombasa, to Garissa and elsewhere. And outside of Kenya to eastern part of Uganda, South Sudan, Tanzania, DRC, the East and Central African region. We pride ourselves as the multi-specialty hospital that covers this area, and with our core mandate as care. Everything here leads with care in terms of the multi-specialty services, but we are also, like I said, a teaching hospital. We also conduct a number of research locally and with our international partners. And we play a very key role in Kenya by informing public policy on health through the Ministry of Health. And there's a lot of research going on between us and our international partners in this building in terms of clinical trials, in terms of therapeutic trials, even now vaccine trials. All of them are going on here. Our staff have really grown in terms of their ability, in terms of their capacity. It has been a big change, and that partnership has brought a lot. I don't think on our own as MTRH or on Moi University alone they would have managed to transform. So the transformational leadership has come because of picking elements of the culture from Indiana and the rest of the partnership. I attribute a lot to that partnership in terms of my leadership and the successes that we've achieved. And I've described some of them in terms of infrastructure, in terms of the systems, in terms of the number of staff from our side who have gone for training. The number of medical students here who have gone for training is just, you can't count. There are so many. And when they come back, you can feel them wherever they are working, that they have had a change in the way they look at things. So we are no longer purely Kenya here in where we are. We have really fused several cultures, particularly the one from our partners of the AMPATH Consortium and the Kenyan culture. And we have a totally different and better culture than if it was us alone. Some of our biggest needs were in management of cancer and chronic diseases. And because of the specific partnership with AMPATH Consortium, we were able to have a center of excellence, this where we are sitting today. Those were the needs that we were facing. We were facing a severe HIV/AIDS pandemic now, but it is now controlled. We were facing cancer and chronic diseases. This is still works in progress, but I see light at the end of the tunnel that we will eventually be able to control it. We didn't have a maternity really and a newborn unit. That was a huge need that has been met by the AMPATH Consortium through the Riley Mother and Baby Hospital. The management of just the current pandemic, the active pandemic, which is the COVID-19, probably would have been challenged were we on our own. But again, the AMPATH Consortium, more specifically Indiana University, came on board and assisted us a lot. In terms of the institutions, you cannot tell who is doing care, who is doing research, who is doing what. The three institutions that form the partnership are all carrying out these functions simultaneously, consecutively. But we have all agreed, as MTRH, as Moi University, as AMPATH, IU, that care leads. But all the others are embedded. In every directorate of MTRH, in every department of MTRH, there is, it's a requirement that teaching is part of our work. So we teach all the students who are here, the fellows who are here, the registrars who are here, all health related trainings going on here. Every MTRH staff participates in the teaching and the training of these people. MTRH, working with Moi University and IU and AMPATH, we do research jointly. So the three functions go hand in hand, including even working in the community. We support a lot. A good example is the population health that is now supporting universal health coverage in Busia, all the way to beyond the coverage area of 25 counties. We are the only public hospital, thanks to our partnerships and the training of our staff that are able now to conduct kidney transplants on a daily basis. We are the only public hospital that does transplants on a daily basis. We are the only public hospital that does corneal transplants. So the impact in terms of lives that have been saved, maybe because somebody was in a road accident, somebody had a cancer, lives that have been saved, in limbs that have also been, saved and corrected. Maybe there was a disability that has been corrected. And in terms of better quality of life for the patients through follow-up, either at the center here, or sometimes we refer them back to the counties. And even for the HIV/AIDS program, for example, they are followed up at the county level and at the facility level. That has led to a huge improvement of the quality of lives of many people. And my estimation would be, if you look at, without looking at the numbers in terms of the diseases, but looking at the region that we serve, which has 25 million Kenyans, you add other millions from the other regions we talked about, we are talking of almost maybe 30 million people that we have impacted on, directly and indirectly. If you talk about job creation, direct and indirect, it's also huge, because look at the amount of dollars that has come through RSPO, through the AMPATH Consortium. It is huge, and a good portion of it is used to hire staff in various areas, both clinical staff and the other corporate staff. Our feelings, and wow, it's been wonderful. Without it, we would probably have gone through a more difficult path. It has lightened our burden, and we couldn't be, even where would we be holding this interview if it were not for that partnership? So, the emotions is huge. It's the feelings, and this is not only me, but it cuts across the leadership here and the staff population. We are very committed as MTRH to see this partnership to go to higher levels beyond where we are. 30 years, but we want to continue counting into 50, hundreds, and many, many years to come. And we would like other areas, either on the African continent or outside the African continent, to benchmark and learn from this partnership of MTRH, Moi University, Indiana University, and AMPATH Consortium. And they are welcome to visit us anytime and learn from us what have we done to succeed. And I normally say, and many of our colleagues in the partnership know, that at the end of the day, it is not even the MOUs that we will sign. It's about the good nature of a human being, the good-heartedness that will make our partnerships to continue to flourish. And we see that in our partners. We see that particularly in Indiana University and the AMPATH Consortium, in the Moi University College of Health Sciences. And we would like this to go beyond us for the future generations to come after ourselves.